Thank you very much and good afternoon. As you know, for today we are reporting on 5 periods over the past almost a week, from December 24th to 25th we had 512 new cases diagnosed with COVID-19. From the 25th to the 26th, an additional 447 people were diagnosed with COVID-19. Between December 26th and 27th, 424 new cases were diagnosed, and between the 27th and the 28th, 441 new cases. Finally, in the last 24 hours from Monday to today, we had 382 new cases diagnosed in British Columbia. The total for the last 5 days is 2,206 people who've been diagnosed with COVID-19, including 25 which were epidemiologically linked. That brings our total number of people diagnosed with COVID-19 to 50,815 people. Over the last 5 days, that includes 378 people in the Vancouver Coastal Health Region, 1,375 people in the Fraser Health Region, 44 people in Vancouver Island Health Region, 238 people in the Interior Health Region, and 171 people in the Northern Health Region. We now have 7,580 active cases around the province, 373 of whom are hospitalized, 80 people in critical care or ICU. In addition, we have 9,414 people under active public health monitoring, and that continues not to include the people who are under active monitoring in the Northern Health, as we're still working on the system. 41,175 people have recovered from COVID-19. As you know, we had a large number of people, sadly, who have been dealing with COVID-19 in long-term care. And over the last 5 days, we've had the tragedy of 74 additional British Columbians dying from COVID-19. Bringing the total number of people in our province who have died from COVID-19 this year to 882. Our condolences go out to all of the families who are mourning their loss, to the care providers, and to our communities who have lost loved ones. We know that this is the most challenging time to deal with these issues, not only because of COVID, but because of the time of year. We mourn with you and feel your loss intensely. We also continue to have new healthcare outbreaks, 8 of which have been called in the last weekend. Brookside Lodge, Rideau Retirement Residence, the Emerald at Elam Village, Heritage Square, Nordic House in Interior Health, and Chartwell Malaspina Care Residence in Island Health. As well, we have 2 more outbreaks in acute care at the Vancouver General Hospital, and early onset of an outbreak at the University Hospital of Northern BC. In addition, the PICS Assisted Living, Courtyard Terrace, Agassiz Seniors Community, and Fort Langley Seniors Community have all been declared over. That leaves us with 56 active outbreaks in long-term care and assisted living, and 8 in acute care. In terms of vaccine, to date, we have delivered 11,930 doses of vaccine to people across British Columbia in every health region now, including over the last 5 days. As well, this is all Pfizer vaccine, but as we know, the Moderna vaccine was licensed for use on December 23rd, and it has now become the second vaccine approved for use in Canada and will be arriving in British Columbia. Some has arrived today, and some will be arriving tomorrow and in the next days. The timing is a little bit in flux, partly due to scheduling, but also, of course, weather across the country at this time of year. As soon as it arrives, however, it will be going to a number of remote and isolated First Nations communities that have been identified, and we've been working very diligently with our partners in First Nations Health Authority to make sure that all of the logistics and training and supplies are in place to make sure we can efficiently provide vaccine in those communities in the coming days. And I think this is a very important and exciting move forward for us here in British Columbia. As well, the Moderna vaccine will be used particularly in the north and interior and some parts of the island to be able to provide immunization to smaller long-term care homes that are in smaller communities. As well, we know that as late last week, we had the ability to start moving the Pfizer vaccine, and that vaccine is now being used to immunize residents of long-term care homes in some areas in the north and interior, but particularly in the Fraser Health and Vancouver Coastal Health regions. With the 11,000, almost 12,000 people who were immunized in the past week and a half, we have had 2 people who have had an allergic reaction to the vaccine. This is not unexpected given what we have learned about the messenger RNA vaccines and what we have seen in other jurisdictions. Both of these allergic reactions were treated appropriately in the clinics, and both people have fully recovered. Both were healthcare workers. So this is a very challenging time as we're ramping up and learning how about these vaccines, how they can be transported safely, making sure that everybody is trained on how to administer them and monitor for events such as allergic reactions, which we know can happen with immunization. And certainly over the last couple of days, there's been a lot of learning and training going on so that we are prepared for how to move the Pfizer vaccine safely in smaller doses into communities, but also how to receive and move the Moderna vaccine. And a lot of the work that we've been doing over the past few days has been to make sure we can do that as efficiently and safely as possible. Over the weekend as well, we issued a statement that we had identified here in British Columbia our first case of a person here infected with the COVID-19 UK variant known as B1.1.7. This person had returned to British Columbia from the UK and had been in quarantine, federal quarantine at their residence, as they were expected to do. A few days after they developed symptoms, and they were tested with our regular NAT test with the nasopharyngeal swab done appropriately, and it was confirmed to be positive for COVID. So that type of a test is the test that we do to diagnose COVID-19 across the province, and we've been using it, as you know, since it was developed in March. That test cannot tell us whether it is a variant or not. What we have been doing also from the beginning of this is using the expertise that we have at the BC Centre for Disease Control in particular to do what we call whole genome sequencing. That's where we look at the genetic sequence from the entire virus, the RNA sequence from the entire virus, to help us understand if there has been changes, if there are mutations, and it gives us a sense of where the virus may have come from. And the first time we were able to really use this to help understand some of the transmission of COVID-19 was when we had identified a person who had tested positive who had come from Iran. And so whole genome sequencing allowed us to determine that this was slightly different than the virus that we had seen before in people coming from China, for example. It also helped us understand the first wave of infections that we saw that were more closely related to strains that were seen in Washington State and also in Europe early on in March and April and May. So when this variant arose in the UK, and we understood when it was published on this Gene Bank website, so that we understood exactly where the variants were, the BC CDC went back to look at anybody who had tested positive on our regular test over the last few weeks, and then did the whole genome sequencing to see if any of them were actually carrying this variant. So far, this is the first case that has shown up. And out of caution, of course, we are making sure that this person remains in quarantine until their symptoms have resolved and they're no longer infectious. And we've done testing on anybody who is in that household, even though the person was meant to be isolating away from them. And this is to be sure that we're being extra careful about whether this virus can be transmitted or was transmitted to anybody here in BC. In addition, we have a number of other isolates, they're called. So the tests that were done over the past number of weeks in people who came from or through the UK, and those are going through whole genome sequencing as well. And it may well be that we will identify additional people who have this variant who are here in BC now. We know, though, that this variant does not seem to cause more severe illness, nor does it seem to have an effect on both the tests or the vaccines that we're using here in Canada. But it does seem, although the details are still unclear, but it does seem in the UK that it causes the virus to be more infectious. And there's one particular mutation on the spike protein that may make the virus more easily bind to the receptors, the ACE2 receptors in the back of our throat and nose, and thus make it more easily for someone to be infected with a smaller dose of the virus. So that is something why we're watching this very carefully and why we support right now trying to slow down any entry of that virus into the country with the current travel ban. As we've seen over the last few days, though, since it's been identified that it is likely that this variant of the virus is going to be found in many other countries, and I just saw this morning they found it in the United States and Colorado. So we are right now, the really important thing that we all need to do is to keep doing those things we know stop the transmission of this virus. This virus is even more infectious, potentially, with this variant. So it means we have to be even more adherent, making sure that we clean our hands, that we stay away from others if we're feeling unwell, that we stay in isolation if we have been around somebody who has COVID-19, that we wear masks and keep our physical distancing when we are out in public spaces, that we keep our numbers small. Right now, that's also an order that you need to stay with your household for any social gatherings. And that is important for us to prevent the transmission of all COVID, but now particularly this variant as well. It is also essential that anybody who has traveled internationally, in particular, that you must obey the federal quarantine and the full 14 days. And if you have any symptoms at all, to connect with public health to get tested. This is incredibly important, and it reinforces the quarantine measures that we have had in place from the beginning and how important they are for all of us. And avoiding all non-essential travel, particularly international travel right now, isn't a nice to do. It is a must do for all of us in this critical period of our pandemic. We know that the majority of people in BC are following our public health orders that we have in place. And like Minister Dix and I, this meant it was a quiet holiday, at least from a social perspective, with our immediate household, or if you live alone, with one or two of your close friends. Now, I have another ask of you, to give the people in our health care system and in our essential services the reprieve they need. We need to make our entire holiday season a quiet holiday season, including the upcoming New Year's. The turning of the calendar to 2021 is something I know we are all looking forward to. How we mark this occasion varies. It varies across the province, it varies by countries, it varies by cultures. But what we have in common is to say goodbye to the old, say hello to the new, and to wish each other a year of happiness, of health, and prosperity. So absolutely, toast the year to come and continue your cultural, your family traditions, but we must do this without the usual house parties or celebrations this year. We need to focus on doing our part to ensure safe and good health for all of us. With that in mind, I want to remind people that our current events and gatherings orders means that any gathering in your home or elsewhere, any social gathering is not allowed at this time. That includes at restaurants and bars. There are to be no events in this coming weekend. We must only go to a restaurant with our own household. And I would encourage people to instead get takeaway from your local restaurant and celebrate with your household at home and connect with your friends and family remotely, as I have seen many great examples of people doing over this past weekend. This is what we need to do to get us through this hump in our pandemic and make sure that we enter 2021 positioned to immunize people who are most at risk and to get us through this next hard few weeks. Every person in our province now is a COVID-19 prevention expert. We know what we need to do to protect those around us, those we care for, and those we don't even know. Every time we follow the rules, we save lives. And right now, that is critical as we get through this important period. Every time you make the choice to bend the rules, to make them work for you, you put yourselves, your loved ones, and our communities at risk. By staying local, staying small, staying apart, by connecting virtually, it protects the people we care about most and ensures that the incoming months and weeks will be better, brighter, and safer for everyone. We need to finish this year and start 2021 in the best possible position, and that means stopping transmission of COVID-19 now as we roll out our immunization programs. And we also, of course, need to continue to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry, and I want to start by reflecting a 5-day report, of course, means larger numbers, both in terms of cases and everything else, but 74 people passed away in the last 5 days from COVID-19. And I want to express my condolences and my thoughts to the families, the friends, the caregivers, the communities of this 74 people, of the 25 who passed away from December 24th to 25th, 14 from 25th to 26th, 14 from the 26th to 27, 11 from the 27 to 28, and 10 from the 28 to the 29. That's 36 people in the Fraser Health Authority, 23 people in the Vancouver Coastal Health Authority, 10 in the Interior Health Authority, and 5 in the Northern Health Authority. It is, as Dr. Henry has said, I think we all know, a very difficult period and a very difficult time to lose somebody. It's obviously, this period is a time of celebration ordinarily, even of coming together ordinarily. And so these are very difficult moments, and we want to ensure that everyone understands that we share their thoughts and share their grief and have them in our hearts today. In terms of, and I think it's just also a good reminder to have them in our hearts on New Year's Eve and on other celebrations that are occurring in this coming period, of what is for some people a Christmas break. And I would just say this, that I think this year it's important to do, however one recognizes the passing from 2020 to 2021, and I know many people would see the passing of 2020 as being not soon enough. But when we do it, let's not leave our communities behind, our loved ones behind. Let's recognize that in our own spaces, with the people in our own households and in our own households only. And whether it's watching the World Junior Hockey Championships, which are taking place, or other things, or Rick Mercer or Ryan Seacrest or whoever we watch on this day, to do it in our own households and with no one else. And I think that's the way all of us need to respond to what we've seen in 2020, and to ensure that 2021 is in fact a better year. I just wanted to note with respect to acute care occupancy that we're running in our regular acute care beds at about 83.6% capacity, which is below what we typically do. That's our occupancy rate. And when you add the surge beds, the beds that have been added to address surges in COVID-19, our occupancy currently is 65.8%. In critical care, our current occupancy of regular critical care beds is 73.8%, and overall occupancy, counting the critical care surge beds, is 50.7%. In other words, in terms of our overall occupancy of beds, we are in good shape, although the pressure in our acute care hospitals is significant, as you can tell by the level of hospitalizations, 373, and on other pressures on public health, including the 7,580 active cases of COVID-19, the 9,414 people under public health surveillance in 4 health authorities, and all of the work being done in public health. As Dr. Henry has said, in our first week of having the Pfizer vaccine, we received, as you'll remember, 4 flats of 975 doses, about 3,900 doses of vaccine, and essentially in the first week, from having the vaccine, all of that vaccine was in fact provided to people, which is good. Over this 2-week period, the one starting the week starting the 21st, the week starting the 28th, we're expecting 30 flats of 975, so that's about 29,250 roughly doses of the Pfizer vaccine. In the past week, 8,100 of those doses roughly were provided across health authorities, including a significant number this weekend. In addition, significant training to deal with the Moderna vaccine took place this weekend, and it's our expectation that the Pfizer vaccine that we will have received, in other words, we're not holding it back, will be delivered to people in the coming week. So that's our expectation of the system. So from 3,800 in the first week to more than 8,000 in the second week to approximately 20,000 in the third week, and that's building up and demonstrates, I think, the extraordinary commitment. That will be basically all of the Pfizer vaccine we have delivered in the period when it was expected to be delivered. I wanted just to bring you up to date on a couple of things we regularly bring people up to date on. We have another immunization campaign, of course, for influenza, and to date, as of December 24th, we know of at least 1,388,805 doses of influenza vaccine have been administered to British Columbians. We know that the number is actually more than that because there's a 30-day reporting lag in terms of doses administered by pharmacists and physicians and other community practitioners, such as nurse practitioners. As of December 24, 2020, all indications of influenza activity remain exceptionally low for this time of year, despite continuing monitoring for influenza across Canada. In fact, the monitoring is more this year for reasons that everyone will understand. To date, there's no evidence of community circulation of influenza. However, influenza testing continues at elevated levels. No long-term care facility influenza outbreaks have been reported in 2020-21. Conversely, during the 2019-20 season, at this point, 6 long-term care facility outbreaks were reported in the same period. I will also acknowledge the continuing extraordinary work of pharmacists, of course physicians and public health, but of pharmacists who have administered 300,000 more doses of influenza vaccine than during the same period last year, and we're very appreciative of their work. So I want to bring you an update that over the past week as well, the following PPE has arrived in BC, 60,880 N95 or equivalent respirators, 414,500 surgical or procedure masks, 41,672 pieces of eye protection, and 7,370,928 pairs of gloves. In closing, I just want to note that as we move towards 2021, I should say, we often think of resolutions, and I think we need to resolve many of the things we've been resolving to do over the last period, to stay apart and to follow public health guidelines, resolve to wearing a mask when we're in indoor public spaces, resolve to not going out and meeting people, resolve to not inviting people to our homes outside of our households, resolve to make the sacrifices we need to keep people safe and save lives. And carrying this resolve into 2021, we can make a real difference. And this week, as in past weeks, I'm asking people to dig in, to be 100% all in, to work as people in healthcare are, with dedication and determination to keep one another safe in this very, very challenging time. I thank everybody for what they did this weekend and what they did in recognizing, finding new ways to celebrate the holiday season. And I ask you to continue to do this in the coming days.